Our next guest is clinical psychologist and registered nurse Vanessa Leongue. Vanessa has worked in medical and mental health with patients across the lifespan, but caring for children and young people is her absolute passion, and working with them through really difficult times in their lives. She's an absolute wealth of knowledge, and it is with pleasure that I welcome Vanessa to the show. Hi Vanessa, and welcome to Kids Health with Dr Nelu.
Hello, thanks for having me.
Very excited to have you on here. Now, you're a nurse and a psychologist. We're a double threat. Can you tell us about why you love doing what you do?
I think people are often surprised when they hear that I'm a nurse and psychologist. So I started off nursing first, and then I love nursing and still do. But I found that I often wanted to stay and chat to the patients and didn't have time to do that. I didn't want to do just all the practical things. I wanted to know what was going on in their mind and how they felt and were they afraid. And I think that's how it led me into studying psychology and becoming a psychologist.
Sounds so fulfilling. It's amazing the work that nurses and psychologists do. I mean, I obviously work with both groups of health professionals, so to be able to do both is amazing. Now, mental health in children is really tricky for so many reasons, but we know that children find it difficult to open up and may not be aware of some of the issues that are going on for them. Can you sort of walk us through what a traditional therapy session looks like for a child? Because many of our viewers may not actually know what this looks like.
Yeah, so therapy with a child is very different to working with an adult. It's a lot more playful. Sometimes it looks like we're just playing because we are. A child's language is still developing, so their way of communicating is through play. So even though we're just playing games, it is a way for them to learn a bit about self-regulation, about their emotions, about negotiating rules and expressing their creativity. When you are learning about emotions, whether it's about anger or anxiety, it's important to make sure that you're not sitting face to face, but you're possibly down the floor playing with the kid as well when you're doing that. So a therapy session with a child, it's important to involve the parents as well at some point.
So are parents present for the whole session, or how does it work?
I try to keep the parents there as much as possible. A lot of the therapy, I do want the parents there, so I may be there to guide some of the play that they have, because a lot of the work isn't about, a child coming in and fixing them, because a child exists within a context with a family, with school. And really, seeing a child for 50 minutes a week isn't going to tremendously impact on their entire life. So I do try to keep parents involved as much as possible.
Yeah, that's a really good point. I guess with children, we're looking at the whole family unit, aren't we? So it's quite a different experience to be a child psychologist. Is it different dealing with teenagers as opposed to adults, for example?
Yeah, well, I do take a developmental history of the child or young person first. So, for example, I recall one of my clients who was a 10-year-old. She presented as, quite mature and thought play was a bit childish. Even when it came to playing with kinetic sand or Play-Doh, she said, "Oh, this is for babies." But after exploring her history a bit more, I learned that an early chaotic family lifestyle where turns out she had to be a parent to her own siblings. Therefore, she never really got to play. She missed out on that. And play is a way for children to then explore their creativity and fears, and she missed out on that. So then I would then incorporate a lot more of that into our therapy. So it's not necessarily looking at their chronological age, but more their developmental or emotional age when I work with them.
Gosh, it sounds so worthwhile what you do, and I can imagine it would be really challenging at times as well. Now, is there any advice that you can give to parents who may be considering therapy for their child?
Letting parents know that it's quite normal to have mixed emotions about coming in and bringing your child into therapy. Some worry that they'll be criticised and told how they're meant to parent better. But I always keep in mind that parents are doing the best that they can with the knowledge that they have and the skills that they have. There's parenting books out there, but really no one is really born a parent, and a lot of the things that we learn are from our parents, which may have been helpful or unhelpful. I think keep in mind that when you're bringing your child to therapy, that the psychologist isn't there to just fix the child. You'll need to be quite involved as well. So I guess make sure that you're already in that headspace. Maybe you can consider seeing your own therapist so that the focus can be solely on your child rather than coming in. And sometimes parents view that space for them to vent as well. So really I need to focus on the child.
Yeah, that's really good advice. And another really difficult situation for parents would be seeing children escalate and behaviours really get out of control. And I imagine that's why a lot of families end up seeing someone like you. Is there any advice that you can give to our viewers for what they can do to de-escalate situations at home, and or just things that they can remember when they're finding that behaviours are getting a bit out of control?
Sometimes there's a lot of negative language used on, the child acting up or they're trying to get attention. Another way of rephrasing attention seeking is attachment seeking. So if something's going on for that child in that very moment, they're upset, their emotions are overwhelming, and they need to connect with someone in that moment, someone to help them realize that it's going to be okay, and that before children can really learn to regulate their own emotions, so we call it self-regulation, it's important to have co-regulation. The co-regulation is having that parent being able to have space for that child's emotions without being too overwhelmed themselves. Because if the parent becomes too anxious or overwhelmed, it kind of tells the child that, oh, this is way too much, your emotions are too much, when really we don't want that. And then we end up having, teenagers and adults around who have been raised to believe that it's not okay to have, distressing emotions, when really there's no good or bad emotions. They're all there to communicate something. So I think that what can also help in working with older kids is, think of them as an age a little bit younger than what they are and what that child may need. Picking them up, holding them, rocking them, being with them. And I'm not too much of a fan of time out, but it's almost like your emotions are too much. I have to go put you in a corner. You need to learn to calm down yourself. Whereas you want the child to know that there's someone, an adult there, who can manage their emotions.
What are some of the positive reinforcement sort of things that parents can do?
A kid can never have too much play. Sometimes parents think that play is just, you're not being serious, but there are lessons to be learned in play, such as I mentioned before, setting limits, start and stop to play. When kids are able to play, there's a part of their brain that's activated where they can learn, create, and connect with other people. Whereas the alternative to play is perhaps, just telling a child what to do, being punitive. That puts them into more of a fear state in their brain. When people are fearful and they're in fight or flight, they can't learn or connect with people. You don't want that to happen.
All right. Well, thank you so much, Vanessa. There's so much there to think about for parents, and it's just so valuable having a chat to someone like you. And I guess it's really important for parents to know that there are child psychologists out there that can support through not just behavioural things, but also parenting and family situations. So thank you again for chatting to us today, and keep up all of your amazing.
Thank you.